Hi, you guys. So super excited to talk about today's topic because let me just make sure my microphone is working. There we go. So we are on the last little bit here. Again, I'm going to share my screen. Here we go. So if you're new and you're joining the 9 markers of health, the most common question that I get asked is, how can we optimize our fertility naturally? And my answer to that is always, well, it depends. It depends what's preventing you from being able to get pregnant naturally or to stay pregnant naturally. And these are the 9 markers of health that I use in order to help me understand what's going on. Because again, I believe that pregnancy is a natural process. So when it's not happening, something is going off. And so we need to assess these areas. And we've done nutrition and digestion. We've looked at what your energy is telling you about your fertility potential, hydration, your mood, stress, movement. We did sleep. And now we're on to the menstrual cycle. So if you want to learn about all of these things, and if, for example, you're not sleeping well, or your energy is really low, or you have digestive issues, or you're wondering about how to exercise for fertility, or does your mood, anxiety, or depression have anything to do with the fact that you can't get pregnant or stay pregnant? How is stress impacting? How much water should I drink? All those things are really important to allow us to figure out what it is that's causing you from not being able to get pregnant or stay pregnant. Because again, I'll say women will always come to me and say, I'm doing everything is coming back normal. But if you don't feel normal, and if you're not getting pregnant, something is off. And so we really, really, really need to take a deeper look, kind of put our ego aside, if you will, and say, what is going on? What can I figure out about my health? So then we can get pregnant naturally and stay, and stay pregnant. And now, don't get me wrong, sometimes we do need medical interventions. It really depends on what's going on for you, what your timeline is, what your goals are. But truthfully, when we do a really good health assessment, when we take a look at how are you sleeping, how are you eating, what's your digestion like, when you look at those, what's your menstrual cycle like, which is the thing we're going to talk about today, then your chances of not only getting pregnant naturally increase, but your chances of having a procedure of any kind that you decide that you need to do in order to get pregnant, the chances of those working are also then increasing. This is a new concept that I've been thinking about, but fertility is kind of a game of probability. Nothing is guaranteed when it comes to fertility, but we can increase our probability by being at our healthiest version, making sure that we have enough eggs, but also that the quality of the eggs that we do have is really good. We want to make sure that the quality of the partner's sperm is really good, that we have a strong desire to have a child with one another, with your partner. And then the last component is making sure that the environment of where the baby is going to grow, the baby room, is ready. So the baby room is the womb, it's the uterus, and we want to make sure that that uterus has a good lining. It's not too thin, it's not too thick. There's good blood flow. There's no pathogenic bacteria. There's no things that create a hostile environment and the baby can't thrive in. And this is why I'm really excited today to talk about the menstrual cycle, because the menstrual cycle is like our monthly report card that tells us what is going on in the room that the baby is going to grow in. So if we have very light periods or lack of periods, it tells me that the room is probably not ready. And whether that means you're not ovulating or the lining of the uterus is very, very thin, we know that there is an issue. The opposite is true. If we have really heavy periods, if we have a lot of clotting, a lot of pain, then potentially the lining of the uterus is really thick, but it's too thick for the implantation to actually happen. And usually that means there is a hormone imbalance as well that's causing the period to be so heavy and so painful and having fibroids and all of that jazz. So what I want to invite you in terms of shifting your perspective is we don't want to cling on to diagnosis. Women often, every woman that I've worked with is like, I have PCOS, I have endometriosis, I have fibroids. And then they're just clung on and that's why I can't get pregnant. I want to invite you to ask yourself a deeper question. Why do I have those things? And beyond the fact that, well, it's genetic, we all have, my genes are riddled with rheumatoid arthritis, obesity, cardiovascular disease, but I don't have any of those issues because my lifestyle and my environment is so different from what my grandmother had and what my parents have. And that's the thing that's going to dictate what genes are turned on and which genes are turned off. And so we don't want to cling on to a diagnosis because that just makes us feel hopeless and powerless. And today, what I'm going to teach you is how to track your menstrual cycle so you can start to understand what your menstrual cycle is telling you. So then you can pinpoint issues a lot sooner. And if your doctor is dismissing those issues, you know you need to find another doctor or another practitioner. Okay? Because the sooner we can get to those problems, the better, the faster you're going to heal from whatever the issue is, because the body's going to take some time to heal depending on what the issue is. So if you've had fibroids ever since you were 15 or PCOS ever since you were 15 and now you're 35, we're not going to get rid of your fibroids in a month, right? It's not realistic to do that, especially if you've been taking the birth control pill or any other medication to just suppress the symptoms. The goal here is to figure out what your body's telling you and to rebalance it. And that's really what I'm passionate about. Like I said, I've worked with many women, and before I got into the fertility space, I thought that women who struggled with fertility had tremendous hormonal issues and there was something really wrong with them and there's no way that natural medicine could touch them. But the more I worked and the more results that I got, I realized that it wasn't a horrendous hormonal imbalance. It's just this community is really, really underserved and it's undereducated in terms of what we can do as women to bring the power back into our bodies, to understand how our body is talking to us and how we can start to advocate for ourselves. What tests do we need to ask for? And, more importantly, what is it that we can do to prevent these issues from happening? Because at the end of the day, the goal is to have a healthy pregnancy and a healthy baby, but we also want you to be healthy. I don't want you to struggle with heavy periods or crampy periods or no periods or mood swings, whatever it is. The goal is for you to actually feel good and confident in your body, because that's going to transfer into your fertility. Okay, so that's my rant. That's my rant for the beginning. Let's go into how to track your cycle and why it's important to track your cycle. So let me see if I can find my chart here. Sorry, give me 1 second. I should have had this. It's not. There we go. This is the one I like to use. Cool. So this is the chart that I'd like to use. And I'm just going to give you a really quick kind of overview of what's going on. If you want to learn more about this, in the guide section, I have a whole training on this that's called Menstrual Cycle 101, and it's really, really great. So I highly recommend that you watch this. If this is all completely new to you, you don't know how to track your cycle, all that jazz. So basically, here's this, right? We have progesterone, that's purple. We have estrogen, that's yellow. Then this is your luteinizing hormone. This is the thing that most women will use to help them know if they're ovulating. And if you've been following me on Instagram or read the last post, I'd love for you to stop using LH strips to tell you if you're ovulating, because LH is a pulsatile hormone. So sometimes it comes early, sometimes it comes late, sometimes it comes right on time. And a lot of women get confused around ovulation just by looking at the LH hormone. So we want to give ourselves tools and understand how our body is talking to us to tell us when we are ovulating. So the thing that I want you to notice as well is, if you're doing body basal temperature tracking, is that your temperature in the second half of the cycle is lower. And then after ovulation, the temperature is higher. So typically, this again depends on the woman, but my temperature doesn't peak until after I ovulate. So it's more of understanding that I have ovulated, but I can't use it to tell me that, oh, my temperature has peaked, I'm ovulating. My temperature peaks after ovulation. Now, for some women, they'll still notice a bit of a peak during ovulation, then a drop, and then an increase. But for some women, they won't. They'll only notice an increase in temperature after ovulation, like myself. So there isn't a right or a wrong. What I'm trying to tell you here is that you are your own individual person, and you need to pay attention to your own symptoms. You need to start tracking your cycle and how your body's talking to you, so you can have predictability instead of relying on tests to tell you that your body is ovulating. We're using tests to maybe confirm, but not to rely, okay? We want to have that power and control within our own system. So, and then of course you see this is the uterine lining. So when the hormones drop, so when the progesterone and estrogen drop, this is when your uterine lining starts to shed. That's the thing that tells the body to, hey, you can start the bleed. If we're pregnant, this is going to continue to stay high. And of course, the uterine lining is not going to shed because there is now the embryo that has implanted into the uterus. So we see that as the lining sheds, the hormone phase is really low, then that estrogen peaks. That's what triggers the ovulation to happen. And then we have that increase in progesterone and estrogen. It's important for this second half phase of the cycle to be 10 to 14 days, 10 days minimum. And then 14 days is typically what it is, 14 plus or minus 2 days. The reason that's really important is because it tells us how your progesterone production is doing. If this phase is really short, it doesn't give enough time for the egg to implant, even if it's fertilized. And so you're simply are just going to get your period. And of course, it's something called luteal phase defect. And typically it's because the progesterone is low, and we need to dig deeper and understand why that progesterone is low and how can we fix it. Why is the body not producing enough progesterone, whether it's to sustain a pregnancy or just for your own, you can have really heavy periods with low progesterone. You can have no periods with low progesterone. Again, every woman is going to be different, but the goal is to figure out why you have low progesterone. Now, the same with ovulation. This increase in ovulation in estrogen, what it does is increases cervical fluid production. The cervical fluid production, that's supposed to be an arrow up. I apologize for that writing. The cervical fluid production is the thing that's telling you that estrogen is high. It's creeping, it's creeping, it's creeping. And so when we have that peak day in our cervical fluid production, that's when we know that estrogen is at its highest, which is the thing that's going to tell your body to ovulate. So if you only have 1 day of cervical fluid production, that's a big problem. That tells me we don't have enough estrogen, or maybe we have estrogen that just stays high the whole time. So when we have imbalance, right, in our estrogen progesterone, and if you have things like endometriosis or fibroids, it's common that you have really high estrogen. And so the body doesn't ovulate because there isn't a change in the hormone. It just stays high. And the body needs the change in order to know it's time to ovulate. So this is really common and could be one of the explanation. Again, the goal is to know why do you have high estrogen, and that could be environmental toxins. It could be an infection, bacteria. In my next lives, I'm going into the lab testings that I run that help us understand why things are happening the way that they are. So this is kind of the basic, the rundown of your menstrual cycle. And now I'm going to share how I want you to track your menstrual cycle to let you know what's going on, right? So you can understand what's happening with a menstrual cycle. This is a really powerful chart. So every chart here, I give it 35 days. This is 1 month. So hopefully you should have 4 months of information of tracking data here. to help you understand what patterns are going on. And this is the legend that I want you to use. So for menstrual cycle, you're going to color red. Now let's see if I can choose my color. Yeah. So you're going to color red. And I would just print this out, and I have this sheet attached. If you want this sheet, just say cycle chart and I'll send it. Yeah, I'll send it your way. And then you're just going to write in here if it's light, heavy, medium, brown, all that jazz. And of course, you're just going to keep coloring it in because that lets you, that's how many days you bled for. Okay. Then little to no discharge, you're just going to leave it blank. And then you're going to note if it was just completely dry, right? And you can just write dry, dry, dry. Or if there was wet, but it was kind of shiny and non-lubricative. Yeah, Veronica, just if you message cycle chart, I'll shoot you an email after this. So just write in the comments cycle chart so I can look it up. And of course, I'm going to share this with you. So just leave those blank. Then if there's any discoloration in there, just make sure you note that down. So let's make sure you understand that discoloration is not normal, but we need to chart it down. And is it cloudy? Is it pasty? You can write those things down. The green is going to be your white cervical fluid discharge. And so you're just going to start to notice when it's lubricative, when it's this kind of shiny, stretchy, it could be a little bit cloudy, it could be pasty, but when you start to get it. And so it's always going to be a retrospective observation, meaning you observe all day and you chart at the end of the day. You don't know if it's a lot of fluid or a little, or what was the stretch. You don't want to chart it with every single time you use the washroom, and you don't need to like play with your mucus. You're just going to wipe front to back and pay attention to the toilet paper and look at what it's doing. Is it stringy? Is there kind of crumbs in the disc, or is it just the egg white consistency? Does it feel really lubricative? And then how much stretch does it have? Half an inch, quarter inch, an inch. And so every day you're just going to make an observation at the end of the day that you are, quote unquote, having this white lubricative fluid, and then just write down how much. So a quarter. For some reason, my pen doesn't like straight lines, so I apologize. It just takes forever to do, maybe it was a half, maybe it was an inch, maybe it was 1+. And then the next day, you might realize there was absolutely nothing. Okay, cool. Now you're back to white, and maybe it's just dry. Maybe it's just dry, dry, dry. And then maybe there's a little bit of kind of wet and damp. Maybe there is shiny. Maybe it's just dry. Whatever it is, there's a discoloration. Like what I want you to do is just observe and write it down in here. And so this is every day at the end of the day, you're writing it down. But what I want to add your attention to here is this P. So the peak white flow discharge is the thing that's telling you that there's a peak in estrogen. And that's the thing that's going to tell you that you're ovulating, tell the brain to start to ovulate. Because ovulation, the egg will live anywhere between 12 to 24 hours, okay? It's a very short window. The sperm lives 5 to 7 days. Now, if the sperm only lives for 2 or 3 days, the quality of the sperm is not good, and we need to fix that. If the sperm is sluggish and slow and it doesn't move much, we need to fix that, right? That's going to be really important. And for the egg, it just kind of depends on the robustness of the egg. But basically, if you see this 1+, this is your peak day. So this is the peak day of when you are ovulating, peak day of estrogen production. And then you're going to write peak +1, peak +2, peak +3. Okay, so these are all +1, It's not going to let me do it. Peak plus 2. And then peak plus 3. Why doesn't it want to let me do numbers? I don't know. Okay. And there should be just 1, 2, and 3. And so what this tells me, and then let's say dry, 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 and then red. Cool. You're going to start back on this month. So we could see it was 26-day cycle. So you might have more dry days in here. You might have more bleeding. You might have this a little bit later. But the point is we should see at least 10 to 14 days in here before the next red. And then you're going to go again and you're going to just start tracking that down. So what this is, and then you're going to see what the discrepancy is each month. This, the moment that you start to have cervical fluid, up until peak plus 3 days is your fertility window. So you can get pregnant up to 3 days post-peak of cervical fluid production. So just because you're dry and you're not producing anymore, it's still, the cervix is actually still open for a couple more days. And so whether you're using this chart to help you prevent a pregnancy or to get pregnant, just know that that window is probably a lot bigger than potentially you thought. So you have an opportunity to get pregnant 1, 2, 3, 4, 5, 6, 7, 8 for 8 days, right? And for some women, that production of cervical fluid is less. So let's say it's 5 to 7. And so that's kind of your window for fertility, as opposed to just looking at the LH strip. Oh, I'm ovulating, we got to go, right? You want to still have some playfulness. You want to still have some kind of freedom within the intercourse window, so you're not so stuck to a specific time frame. But this chart, you guys, is going to tell you a lot. And if you figure out that there's a lot of issues and it's super irregular and it's super heavy and painful and you need some help, then go ahead and just message the word help and let's chat and let's see how I can help if you are looking for a practitioner to work with. So if you want this chart, go ahead and message cycle chart in the comments. So whether you're watching it live or you're watching it in, on the replay. And if you have been doing some cycle charting and you know you have issues, go ahead and message the word help and I'll send you a message and we'll see if I'm the right person to help or, what it is that you're looking for and how long you've been struggling. Okay, that's it. I hope you guys enjoyed this. Please feel free to rewatch it. I know it was a lot of information, but like I said, my goal is to really educate you so you can feel empowered and you can start to understand what's normal, what's not normal. And you're not making decisions based out of a place of desperation and hopelessness and powerlessness. We want to come into the opposite of that. We want to have confidence. We want to have trust in our body. We want to understand what our body is trying to tell us. And more importantly, we want to have the tools to know how to fix those things because they're very, very fixable. And it might just take some time and it might take some digging. But if you're dedicated and you're dedicated and you're willing to do the work to figure out what it is that's going on and you want to fix it, then it's very, very doable. No quick pill fixes. That doesn't work with the body. It just doesn't. And we can do better. So I hope you enjoyed this video. Let me know if you have any questions in the comments below. Comment cycle chart if you want a copy of the cycle chart, and then comment help if you're looking for a practitioner to help you. Until then.